Hey there, it's that time of year again. Road trips, pool parties, and unfortunately, a surge in COVID-19 infections. The dreaded summer surge has arrived, and I'm here to give you the latest on symptoms and treatments. Dr. Maria van Kerkhove of the WHO recently highlighted that COVID-19 is still very much with us. Data from 84 countries show a rising trend in positive tests for the virus. Here in the US, infections, emergency room visits, and deaths are all creeping up. According to the CDC, test positivity was projected to exceed 16% by the end of July, making this summer surge one for the books. So, what are the symptoms we should be watching for? COVID-19 symptoms can appear anywhere from 2 days to 2 weeks after exposure. They include congestion or runny nose, cough, diarrhea, fatigue, fever or chills, headache, muscle or body aches, new loss of taste or smell, nausea or vomiting, shortness of breath or difficulty breathing, sore throat. These symptoms might sound familiar because they overlap with the flu, the common cold, and RSV. Dr. Donald Dumford from Cleveland Clinic Akron General recommends getting tested if you feel ill. Testing is the only way to differentiate between these respiratory illnesses. Now let's talk about emergency symptoms. The CDC says seek immediate medical care if you're experiencing inability to wake or stay awake, lips, skin, and nail beds that appear pale, blue, or gray, new confusion, persistent pain or pressure in the chest, trouble breathing. If you test positive for COVID-19, you no longer have to isolate for 5 days. Instead, the isolation period depends on how you're feeling. If your symptoms have been improving for at least 24 hours and you haven't had a fever without medication, you can resume normal activities. After that, wear a well-fitting mask for the next 5 days. This helps mitigate the risk of spreading the virus. When it comes to treatments, most people can manage mild symptoms with over-the-counter medications like ibuprofen or acetaminophen. For those at high risk, antiviral medications like Paxlovid and Lagevrio are available but must be started within 5 to 7 days of symptom onset. Preventive monoclonal antibody treatments are also an option for those who are moderately or severely immunocompromised. Always discuss your treatment options with your healthcare provider. And what's the deal with the new vaccines? The CDC recommends everyone ages 6 months and older get the updated 2024-25 COVID vaccine this fall. New vaccines from Pfizer, Moderna, and Novavax will be available later this year. You can even get your flu and COVID vaccines at the same time. Plan now to get vaccinated and protect yourself and your loved ones. That's all for now. Stay safe out there and take care of yourselves. Don't forget to like, subscribe, and hit the notification bell for more updates. Until next time.